resolution. So the title of the resolution is Building Social Media Resilience as a Tool to Fight Misinformation. We are aware that how impactful social media is in influencing behaviors, either good or bad, which can be seen through misinformation disseminated through various social media platforms. Our region are also alarmed by the numbers of misinformation disseminated through multiple social media platforms, especially regarding the COVID-19 vaccine. Noting further that this misinformation has jeopardized efforts to vaccinate the world population to reach herd immunity, especially in our nation blocks. And we also take into account that the situation, we find that the root cause of the issue would be that there is no agency or body that regulates disinformation through social media. How are we looking to resolve it? We call for action by the central government to be responsible for regulating the social media platform in preventing misinformation from propagating. The federal government should create a regulatory framework and guiding principle on social media and health information. We also encourage the government to include community partnership and community members in addition to local agencies to disseminate the message and collaborate with these stakeholders to debunk misinformation. Local agency or leaders also include influencer, health professional, or even nonprofit organization and communication, not only government-related agencies. We also further recommend that education programs and health literacy surrounding the topics of vaccine hesitancy and misinformation are incorporated into social programs to develop digital capacity and encourage children to be active consumers of health information. And by the end of the day, we also like to congratulate nonprofit organizations and health experts for their continuous efforts in fighting misinformation in the social media space, especially during the national vaccination rollout.
The chair of SER region, would you like to yield your time to the chair?
I would like to yield my time to the chair.
Thank you for presenting the whole resolution from WPR region. Does anyone would like to challenge this resolution? Please raise your hand in the chat box. We will call it for 3 times. Does anyone would like to challenge the resolution from SER region? Please raise your hand. The chair of Afro region would like to challenge the resolution from SER region. Please, the chair give time to Afro region chair.
Yes, thank you. Thank you very much for the resolution. And yeah, I just want to give some feedback, but I think it's a very good resolution paper. So thank you very much. For me, I think it's maybe a bit more appropriate for the last operative clause, the congratulate, perhaps to put this one in the preambulatory clauses, because it's not really an action. It's just it's not an action. So I think it would be more appropriate to have operative clause 4 in the preambulatory clauses.
Thank you, Chair of Afro region, for raising the issue. Any team member from Zero region would like to reply back to the challenges request set by Afro region chair? Okay, 2 members, hand up. Okay. We will give the Zero regional blocks to defend this challenge first, then we will give another another challenge from Italy. Is there anyone would like to reply back the comment from Afro region chair? Does anyone from Zero region would like to reply back the feedback from Afro region chair? One time. Does anyone like to reply back the feedback from Afro Region Chair? Two. Does anyone from Zero Region would like to reply back the Afro Region Chair? Three times. No response. Then we will move out to the Italy. The delegate of Italy would like to raise, challenge the resolution from Zero Region. The chair gives time to the delegate of Italy. Please, delegate of Italy, proceed.
Thank you so much, Mr. Chair, and good morning, everyone. I just would like to add that the operative clause number 3, that we should include, it's very integral that we include parents and teachers, because they are the ones who making decision for their children's vaccination program. So it's really important that we put the health literacy among parents and guardians when we're talking about a school-based setting. Thank you.
Thank you, the chair, the delegate of Italy, for raising this point. Any team member from Zero Region would like to reply back the feedback from the delegate of Italy? Please raise your hand. One time.
Sorry, can I interrupt and just say, perhaps Kentika, you can clarify this point?
Okay, there is a raise of hand.
Okay.
Delegate of India, please reply back to the delegate of Italy or for his feedback.
Thank you. Thank you, delegate of Italy, for raising that point. Actually, that is included in like, maybe it's not presented in the word form, but it is included in this. It has this intention of including parents and guardians in this, because children are what I had in my mind, that children complete or solely independently won't be using this app. The parents and the guardians and the teachers will be involved to go through what exactly is being circulated. That was the intention in that. Thank you so much.
Thank you, delegate of India, for replying back to the delegate of Italy feedback. Is there anyone who would like to reply back again, or who would like to challenge the resolution from the Zero Region? Delegate of Italy, raise the hand, and delegate of Italy, please proceed.
Yeah, according to the Cochrane Library, we all know that we're talking about school-age children. The most important people in their lives are their peers, in which cannot be able to make decisions from themselves. And I think it's really important that we engage parents with the decision making when it comes to this one, because children doesn't have the capacity to, or children don't have the capacity to decide from themselves when it comes to their health issues and vaccinations. Thank you.
Thank you, delegate of Italy, for your feedback again. Is there anyone like to challenge the resolution from Zero Region? Two time. Is there anyone would like to challenge any causes from Zero Region? Last time. Is there anyone would like to challenge the resolution from Zero Region? Okay, there was no challenge anymore, and I would like to finalize final asks to the Zero Regional block whether they would like to amend the feedback that they receive, or they would like to move on with this resolution without amending any point discussed from the feedback. Please, Chair of Zero Region, raise your hand and discuss about whether you would like to amend this resolution, or you would like to continue with this same resolution.
Okay, let me Raise my hand. Thank you. Thank you, Chair. We would like to amend this resolution.
Thank you, the Chair of Zero Region. And the Chair will give 10 minutes of amendment after the resolution presented from the Afro region to amend in your own group. Thank you very much for your presentation of your Zero regional block. And thank you for sharing the screen. And we will move on to Afro regional. So Nabil, can you stop sharing the screen so that we can give other regional block to share the screen? Okay, thank you. Thank you very much to Zero region. And please delegate or chair of Afro regional blocks, Afro, EMRO, and EMRO regional block, Euro regional block to present their resolution. Who will present the resolution? Defend, please let me know. Melanie, defend. Who will?
Yes, Melanie will be presenting the resolution, but Melanie, if you want me to share the screen, I can do that.
Yes, thank you. So my internet is not great, so please, if I start breaking up, please let me know, and I will try to fix it.
Okay, the delegate of the chair of Afro, Euro, and EMRO region get 10 minutes for present your resolution.
Yes, thank you very much, and thank you, everyone. Also, thank you to the chair of the Zero region for the previous presentation. So I am representing the Afro, EMRO, and Euro regional blocks, and we have made this resolution paper with as topic raising awareness and creating legislation of information spread regarding public health on social media. And we have multiple signatories, namely Pakistan, Cameroon, Italy, Greece, the Gambia, the NGO Save the Children. We have Sudan, Mali, and the NGO Health Through the Walls. So we have 6 preambulatory clauses, of which the first is recognizing the role that public health misinformation played in the COVID-19 pandemic in decreasing vaccine coverage in countries, in increasing public distrust in governing bodies, and in an influx of mental health issues in the population. The second one is aware that public health misinformation on social media results in distrust of the government, public health professionals, and healthcare workers, and can have a negative effect on one's mental health. The third one, reaffirming that the spread of misinformation on social media impacts public health and health outcomes of a population. Convincing that there is a lack of legislation and monitoring of the spread of public health misinformation on social media. And we also have to recognize the efforts. We have one that is noting with satisfaction the past efforts of governments, healthcare institutions, healthcare workers, and public health professionals in spreading accurate public health information through the use of social media, and actively attempting to prevent or mitigate the spread of public health misinformation on social media. And our last preambulatory clause is stressing the need for further research, legislation, and implementation of interventions to prevent or mitigate false public health information being distributed through social media. So these are preambulatory clauses, and I believe we have 8 operative clauses, of which the first one is encourages the World Health Organization to invest in global health research in improving health literacy, specifically on the topic of vaccination and public health misinformation on social media. Calls upon governing bodies to devise culturally appropriate strategies to spread trustworthy public health information efficiently and effectively on social media, especially to vulnerable groups, such as, but not limited to, children, elderly, the chronically ill, and inmates. Encourages the World Health Organization in creation of a specific social media and public health department, which can guide nations in the drafting and implementing of guidelines and protocols regarding this topic and be a liaison between public health and frequently used social media. We have urges governing bodies to define and monitor social media misuse, such as the deliberate spread of public health misinformation, and enforce fitting measures to prevent and mitigate this behavior. Propose nations to design and implement nationwide education programs on the spread of public health misinformation, health and media literacy, vaccine coverage, pandemics, and mental health. Request global health communities to conduct further research and make recommendations regarding the public's distrust of the government caused by public health misinformation on social media and on reducing the prevalence and mitigating the effects of mental health issues on populations, particularly of vulnerable groups such as youth, and on the factors surrounding vaccine hesitancy during public health crises. We have urged governments to promote time-tested optional vaccines to be included in the national immunization program and to strengthen the usage of surveillance and monitoring tools related to the communicable and non-communicable diseases. Encourages research publication companies to lower or waive the cost of open access research fees related to mass and social media information and misinformation, and urges governments to increase collaboration with data analytics for practical innovative solutions on social media misinformation. So it's quite a lot of information, but we wanted as goal to improve awareness, legislation, and research about misinformation and public health. And also we saw that a lot of it resulted in the public's distrust of the government. So we also want to tackle that. And with the resolution paper, we hope we can do more research, we can create some guidelines, we can create legislation to tackle public health misinformation. And we can also strengthen communities, their health and media literacy, so they can have guidelines to navigate all the public health information on social media, especially during pandemics and public health crises. So thank you very much for listening. And I would like to yield my time back to the chair.
Thank you, the chair of Afro, Euro, and EMRO region for presenting your resolution. Does there anyone would like to challenge the resolution from this regional block? Please raise your hand. One time. Does anyone would like to challenge any of the resolution point presented by this regional block? Will please raise your hand. Two times. Does anyone would like to challenge any resolution point presented by this Afro, Euro, and EMRO region? Please raise your hand. NGO can also challenge the resolution as well. Okay, Liana, raise your hand, please. Liana, proceed.
Thank you. I just, not a question, I just wanted to ask a question. It's a little bit hard to see. Tiffany, can you scroll up a little bit? Sorry, just because I don't remember exactly what's written. Just to the top of the operative clauses. Yes, sorry. So I just was wondering how you propose that, like, financing this you know, coalition, I guess, between the World Health Organization and the global research, how you propose that would kind of go about. I was just wondering about financing in terms of this project.
Thank you, Diana, for raising the issue. Does anyone from Afro region would like to reply back to the Diana point? Please raise your hand. Does anyone from Afro region, Afro, Euro, and EMRO region would like to reply the Liana points, please raise your hand. Okay, Delegate of Italy, please proceed.
Thank you so much, Ms. Chair, for that question. I think it's very necessary to just include non-governmental organizations to include in this global health research to avoid any conflict of interest, which is also, we are actually avoiding from nation to nations. And it's actually very important that we take note of that, because we don't want any political issues with regards to this matter. Thank you.
Thank you so much for your response.
Thank you, Delegate of Italy, for the response. Delegate of Pakistan, you would like to reply back? Please proceed.
Thank you, Madam Chair, and thank you, Liana, for raising that very important question. I think one of the main purpose of this resolution is to also create awareness in the political aspect. So like if we take Pakistan for an example, the division of budgets towards the health sector is socioeconomically inappropriate. So one of the outcomes that we hope this resolution brings is that there will be more division of budgets towards the health sector and towards these social media misinformation interventions. So that could be one channel of financing.
Thank you, Delegate of Pakistan, for clarifying.
Thank you, Delegate of Pakistan, for the reply. Delegate of Mali raised the hand. Please proceed.
Thank you, Mr. Chair, and thank you, Liana, for the question. Very good question, I must say, because he who pays the piper dictates the tune, as we all know. So, but I would suggest that we can think of a tax, a social media tax that can be drawn from people, from organizations, the social media organizations and different social media outfits, which will be drawn and be used to curb or to monitor social media misuse and all those kind of things. So, I mean, the details are not very clear yet, but something around the nature of a social media tax is what I propose. Thank you.
Thank you for that point.
Thank you, Delegate of Mali, for the feedback. Does anyone have anyone would like to challenge the resolution from Afro, Euro, and Emerald region? One time. Does anyone would like to challenge Afro, Euro, and Emerald region resolution? Please raise your hand. Two time. Does anyone from other regional, does any delegate from other regional bloc would like to challenge the resolution from Afro, Euro, and Emerald region? Please raise your hand. Three times. No response. So we will conclude the session, but we would like to ask the chair of Afro, Emerald, and Euro region whether you would like to amend your resolution or not.
I think since the other also have 10 minutes, we can also have 10 minutes just for the final dots on the i's, so we can also address Lena's feedback. So yes, thank you.
Thank you, the chair of Afro, Emerald, and Euro region. You will get 10 minutes session for your amendment. Thank you all the delegates.